Hello, my name is Samantha Rawdin. I am really excited to be part of the first group of dentists who has gotten to test out the NEVO implant from Thommen, and I'm going to share a couple examples with you today. So first, a little bit about my background and how I came to utilize the Thommen system. I'm a board-certified prosthodontist, with an additional fellowship in implant dentistry, and I currently work in private practice with my father, who is also a prosthodontist, and we're located right in New York City. The way I came to use the Thommen implant system was actually because of my father. He had his lower left first molar extracted several years ago, and he needed an implant. And when it came time to planning it, the edentulous space was very wide, and he wanted an implant that could support a robust restoration on top of it. The existing systems that we had in our office didn't offer a wide enough diameter implant, and as my dad had restored several Thommen implants previously, he decided that he wanted a Thommen implant for himself. So here you can see a 6 millimeter Thommen implant I placed for him back in 2018. And this is a follow-up x-ray just taken 2 months ago, and I've been using this Thommen system ever since. Last year, we were fortunate enough to be invited to the Thommen headquarters in Grenken, Switzerland, and I loved the system before I visited, but being able to see firsthand the vision of the company and the precision behind their systems just blew me away. And while we were there, it just so happened that the team was in the midst of testing their new system, the NEVO. Before I left, I practically begged them to let me test it out once it was available. And fast forward to now, I've treated 2 patients thus far, and I would like to share their cases with you now. These are the 2 gentlemen I have used the NEVO implant system for, Phil and Peter. You'll hear about Peter in just a second. Phil decided that it was time for an implant right around when we first got access to NEVO, and I knew right away it was what I wanted to use for him. But the night before his appointment, he called, said he was sick. But in that appointment slot that Phil was supposed to be there, Peter called with an emergency. He was a new patient to me and from Virginia. He's a 73-year-old male who's on medication to manage high cholesterol and hypothyroidism. He's a smoker. We've discussed risks having to deal with smoking. He also has a penicillin allergy. He's a symphony conductor, and he would only be in town for a few days. The night before he called, Peter was eating popcorn, and he felt a crack. And when he came in, we did an exam, and we determined that he fractured the palatal cusp of his upper right first premolar, and he was in a lot of pain. So I removed the broken fragment there, and the level of the fracture extended below the crest of the bone. So we knew that the tooth would need to be extracted. We discussed all his different treatment options, and it was decided to do an extraction with immediate implant placement. The fractured tooth was extracted atraumatically, and the socket was thoroughly curetted, and the buccal plate luckily was noted to be intact. Based on the size of the socket, a 4.0 by 9.5 millimeter implant was selected, and lo and behold, I had a spare NEVO hanging around my office from Phil's canceled appointment. Because the patient would be traveling for work and unable to return to New York for an extended period of time, he required a provisional restoration. So I decided that the progressive threads of the NEVO would be appropriate for this site to maximize that primary stability while still being gentle enough not to overload the bone and have that tried and true, predictable soft tissue healing that I love so much about the Thommen implants. Implant was placed to 35 Newton centimeters. We placed a scan body, and provisional restoration was milled out of PMMA. It was then cemented on a tie base, and we kept it out of occlusion in maximum intercuspation and excursions. And this is how Peter left that day. He was super happy with the outcome, and he was given strict postoperative instructions to avoid chewing anything hard on that side. Since he was returning to Virginia, I didn't have the opportunity to do my typically scheduled 1 to 2 week post-op visit, but I spoke with him. He said that everything felt fine. He had minimal discomfort following the procedure. But about 5 weeks later, I got an email from him saying that he bit down really hard on something. He forgot about our instructions. And then it hurt for a second, and he felt like the tooth had moved, but it had been fine ever since. So I convinced him to come up to New York so I could take a peek, and he came up the following week. And the provisional restoration was definitely positioned a little bit more buccal than we had left it. Unfortunately, I didn't have any photos from this visit, but the implant felt solid. The provisional wasn't loose. He had no pain, no other symptoms. And we took a radiograph at the time of the visit, which you can see here on your screen. I informed him about the integrity of the implant potentially being compromised, but at this point, there was no indication to do anything. So I said, let's just give it time. And he was instructed to call if he developed any other symptoms, but I haven't heard from him since, and he's scheduled to return next month for his impressions. So stay tuned here. Next up is Phil. He rescheduled his initial appointment just a week or two later. He is a 60-year-old male, HIV positive, but his levels are undetectable with medication, and otherwise he's got no contributory medical history. He has several other implants in his mouth, which have been very successful, but he does have a history of a failed implant at the site of the upper right canine where we're working. The failed implant had an immediate provisional on it, and we believe the reason for failure was occlusal overload, since he is a bruxer. The site where the implant had failed was grafted and left to heal for 6 months, and when a CBCT was taken, it revealed there was adequate bone for implant placement. In a previously failed and grafted implant site, I wanted an implant that would ensure adequate primary stability, but also be gentle enough not to overload that bone. You can see the sections from the CBCT that was taken, and we didn't have the library file within our software yet for the NEVO implant, but one of the things that has made this transition to using the NEVO so easy is that the geometry of the NEVO is exactly the same. The external geometry, I should say, is exactly the same as that of the element, so it makes it very easy to plan. A 4.0 by 9.5 millimeter size NEVO was selected, and the implant was placed in a fully guided fashion. But the biggest difference between this drilling protocol and that of the element fully guided implant protocol is that the last drill to use for the osteotomy is the 6.5 millimeter length, since it corresponds to the junction on the NEVO at which the body begins to taper towards the apex, and those threads get progressively wider. So the implant was placed to 45 Newton centimeters using a one-stage approach, and this time around, instead of an immediate provisional, a healing abutment was placed. And here is the periapical radiograph of the implant right after placement. Patient came in for a follow-up. He said everything was feeling great, and he'll be back in about a month or so for his definitive restoration. So, of course, these treatments are not complete, and I will be curious to see how each of these patients heals. But overall, I've been really, really impressed with the NEVO implant. It combines everything I love and can rely on from the Thommen system, from the surface to the innocell to the extensive scientific studies proving its efficacy. But now I have an option to give my patients a more robust thread pattern to give me that high primary stability, but yet it's still gentle enough to know I'm not overloading the crestal bone, and it's going to be kind to the tissues. So again, overall, very, very happy so far with it. Thank you very much.